Welcome to Unfiltered Talks with Shahnaz Mirza. I am Shahnaz Mirza. In today's episode, we shall talk about Down syndrome. Down syndrome is a genetic condition that affects thousands of individuals worldwide. But what exactly is it? And how does it impact our lives? In this episode, we shall try to understand Down syndrome a little better and to help parents make informed decisions about their child's care, therapy, and education if they have Down syndrome. Our guest today will take us through the physiological and psychological effects of Down syndrome, its causes, and the kind of support that families and caregivers can give to such individuals. Dr. Priyanka Poomani is a dedicated general pediatrician with a deep passion for nurturing child health and advocating for young lives. She has graced international stages as a keynote speaker, sharing her insights with global audiences, and has enriched the medical community through publications in renowned journals and insightful case reports. Beyond her clinical and academic contributions, she connects with families and the wider community as the host of a weekly Friday radio show in Doha, Qatar, where she explores child wellness, parenting, and holistic health. Outside of medicine, Dr. Priyanka enjoys the thrill and precision of driving, especially manual cars, reflecting her love for control, adventure, and mastery. Welcome to the show, Dr. Priyanka.
Thank you for the compassionate introduction, Shahnaz. It's my pleasure to be here.
Absolutely. Let's dive straight into it. Now, what is Down syndrome and how does it occur?
Down syndrome, we also call it as Trisomy 21. As all of us know, humans have 46 pairs of chromosomes, but then in Downs, we end up having an extra chromosome 21, ultimately leading to having chromosomes, that is 47 chromosomes.
So Down syndrome is a genetic condition. So what is the role of genetics here, basically?
This is all about embryonic development, which happens in the period of embryology. That is, there is going to be an error in the cell division during the embryonic period of life. That is, number one is meiosis. Meiosis is actually, basically speaking, it's the formation of egg and the sperm. And during this period, meiotic non-disjunction happens. That is, there is no proper junction of these chromosomes. That leads to an extra copy of chromosome 21, leading to meiotic non-disjunction. And this is one of the genetic factor, and this is possibly leading to 95 cases of Down syndrome. Then comes your translocation. We say Robertsonian translocation. That is, most of the time, chromosome 14 and chromosome 21 end up having an attachment, and that leads to 3 to 4 percentage of the cases of Down syndrome. And then we have something which is called as mosaicism. That is all regarding genetics. It's basically cell division. There is going to be an error in cell division which predisposes to Down syndrome.
So basically you're trying to say that there are 3 different forms of how Down syndrome could come into play.
Yes.
So first one, you mentioned that instead of the trisomy 21, and then the second one is Robertsonian translocation, and the third one is
which happens after fertilization, mosaicism.
The mosaic, okay,
yes.
Mosaic way. And each of them leads to Down syndrome, basically. And in terms of age plays a factor, because I had read somewhere that if the mother is maybe below 20, or if she's very old, 48 plus, there are greater chances of her.
Yes.
So is that true?
When it comes to causes, we have genetics, as we have discussed about meiotic non-disjunction, translocation, and mosaicism. But then when it comes to risk factors, it's advanced maternal age, we can say.
Right.
So when it is like the mother is around 25 years of age, the probability of having Down syndrome is just 1 in 1,200.
Okay.
When she is around 30 years of age, Down syndrome occurs just in around 1 in 900. Live births.
Okay.
When she's around 35 years of age, when the maternal age is around 35 years, it's 1 in 350. Think about the incidence. And when she's around 40 years, it is just going to be around 1 in every 100. And when she's around more than 45, it's going to be 1 in every 30.
So as the age advances, the risk is greater to have Down syndrome.
That's-
Okay. And is it hereditary? Like if you had in your grandparents, parents, or early generation somebody having it, is it more likely that one can have this condition? They can deliver a child with Down syndrome? Is that true?
Yes, true. It's exactly true, because most of the cases we have a lot of panel of tests to detect if the mother is vulnerable or she's going to develop a Down syndrome, if she has conceived a child with Down syndrome.
Okay, moving on. How early can we detect this condition?
So
Correct.
from 11 to 13 weeks of gestation, we have something which is called as NIPT.
Okay.
That is non-invasive prenatal test. This is actually used to detect all the cell-free fetal DNA. This is a part of prenatal technique. And yeah, and then you tend to get some blood test. That is, number one is PAPA, pregnancy associated plasma protein A, and another one is beta HCG, that is beta human chorionic gonadotropin. And these are the tests actually constituting prenatal screening. And you have another couple of tests also that is done in first trimester and second trimester.
Okay. So a doctor or a gynecologist, she will be able to assess in early gestational period that there is a need to do this test, or how would she just decide that, yeah, let me give this test, or are these tests run for all parents who are expecting, all mothers who are expecting?
No, this is actually, we have a panel of tests that
Okay.
is being given to the antenatal mothers, but this is something different. We tend to give this test when we expect Down syndrome. Like in the if the mother is like found to be an elderly preemie, she's having preemie is the first time she gets conceived. So if she's more than 30 years of age, you can expect a child to have Down syndrome. So at that time, if there is any elderly preemie mother presenting to you for the first time with pregnancy, you can give this test. Second, if there is a family history of Down syndrome in the family. And the third one, if she has already had a baby with Down syndrome, previous pregnancy with Down syndrome, then you can suspect the baby to have a recurrence. So
okay.
these are the ideal indications where you can prescribe the mother with these panel of tests.
And how common is it now that this condition of Down syndrome, how common is it? And are there different types of Down syndrome?
Basically, we don't have any types of Down syndrome. We just have all the predisposing factors in the genetics which have proved to be the predisposing factors for Down syndrome, as we have discussed about Robertsonian translocation, meiotic non-disjunction, and mosaicism. And about the common, its incidence, we tend to have around 1 in every 700 live births today.
So if the doctor is able to detect with the mother who's pregnant right in the first trimester, well and good, and you've suggested some tests that they need to do. If it is not detected at the first, are there any other tests in the second or the third trimester that the mother can get done, or that the doctors, if they find out at a later stage, can be done to also rule out this condition?
Yes, as already we have spoken, prenatal screening. We have spoken about beta HCG, your pregnancy associated plasma protein, and then we have NIPTs, that is cell-free fetal DNA detection. When it comes to first trimester, that is around 11 to 14 weeks, we have a scan which is called as NT scan, that is nuchal translucency scan. Normally, this is supposed to be only less than 3 mm. If it is going to be more than 3 mm, it is highly suggestive of Down syndrome. And then we also have something which is called as triple screening and quadruple screening, which we can get it done in the second trimester.
So these are basically ultrasounds that you have to do.
Nuchal translucency is your ultrasound.
Okay.
Everything which I'm talking about is your maternal serum estimation, your pregnancy associated plasma protein, your beta human chorionic gonadotropin, everything you tend to measure from the maternal serum. And we also have something which is called as chorionic villi sampling. We tend to do it from 13 to 15 weeks. That is within about the first trimester. That is like you tend to take the mother's villi, that is from a small piece of tissue from the endometrium, that is the uterus lining, and then you predispose it for karyotyping, out of which you will be able to detect all the DNA mutations, out of which you can also detect trisomy 21, trisomy 18, and trisomy 13, a lot of conditions.
Okay.
When it comes to second trimester, we have two things with. That is, number one is triple screening. That is a panel of maternal serum blood test. That is, number one is beta-HCG again, and then you have alpha fetoprotein here, maternal alpha fetoprotein, and then you have estriol, a precursor of estrogen. And we have quadruple test. Some of the doctors, some of the physicians also go for quadruple testing in the second trimester. That is, along with triple testing, that is beta-HCG, alpha maternal alpha fetoprotein, and your estriol. You also have inhibin. This is also being tested from the maternal serum.
Okay.
And here you undergo amniocentesis.
Okay. So basically there are a lot of tests. This is what I can understand, because I would not know the details and nor would our viewers. But yes, there are a lot of tests that doctors can perform and get to know that yes, maybe this child is going to have Down syndrome. And if suppose in any of the trimesters the doctor was not able to, for whatever reason, they did not detect it or did not think, and now the baby is born. Once the baby is born, is there a way that the pediatrician or after the baby is delivered that they can look at the baby and say, yes, this baby has Down syndrome?
It is the duty and the ethics of each and every pediatrician on the resuscitation table after the baby is born to undergo a proper head-to-toe examination. We look for the fontanelles, and we look for the toes, we look for the digits, we look for any abnormalities, skin tags and all that. So we have, when we suspect Down syndrome, like we have a sort of like a entity which is, we have an entity which is called as Hall's criteria. We have around 10 points in that. Number one is your flat facial profile. You have upslanting palpable fissures. Then you have, when you have a lot of creases in your palm, the Down syndrome child has only one palmar crease. We call it as simian crease.
You mean he has only
one line, only one crease.
All these other lines are not available.
Yes.
Okay, wow, that's interesting.
It's interesting, right?
Yeah.
And then when it comes to fingers, I mean your lower limbs, there is going to be a wide gap between your great toe and your second toe. That is called a sandal gap. That is also highly suggestive of Down syndrome. And then sometimes there is going to be a lot of loose skin in the neck, redundant skin.
And also I've noticed that sometimes they have very broad necks.
True.
The necks are also broad.
Exactly.
And eyes, they're mostly like Mongolians, because I think at one time it was founded by Dr. John Langdon, a British doctor, John Langdon Down. I think that's how the name came, Down syndrome. And then later on, he also called it Mongolian, but because then they had to correct it, the name, and then they gave it the proper name.
We used to call it as Mongolian slant.
Because the babies mostly would have that kind of a
Mongolian
slight,
slant.
with the eyes. Features like Mongolian mostly.
Yes.
So is it still called Mongolian baby or some?
We used to call it as Mongolian slant. We have another spectrum of causes for Mongolian slant also. We have a lot of causes, but the most common one we used to talk about is Down syndrome.
All right. Now, besides that you've seen all these in the baby, any other physical development that is not happening compared to a normal baby with the baby who has a Down syndrome?
When we talk about newborn, you can expect the baby to pass urine within about 48 hours. But for the first stool for the baby to pass, it has to be within about 24 hours. So if any baby, and the first stool is called as meconium, that is going to be in green color, greenish black, something like that. If the baby doesn't pass the first meconium within about 24 hours, you can suspect the baby to have a wide spectrum of causes. The first one is going to be a congenital hypothyroidism. The baby will be having a defective thyroid gland where there is going to be deficient production of thyroid hormones. And Down syndrome, for whatever reason, is one of the most common cause of congenital hypothyroidism.
So if they detect congenital hypothyroidism, that means the baby is having Down syndrome.
Can also have.
Could be other reason also. But okay. So if they detect this condition, then you may check for Down syndrome.
Yeah, along with your Hall's criteria, we were talking about the flat facial profile,
features. Yes.
This congenital hypothyroidism is going to be an add-on for you to suspect congenital hypothyroidism.
Got it. Perfect. Yeah. So the meconium, that is very important. And in my first child, my child delivered meconium in my womb, inside me, and I was rushed to the hospital, my firstborn. And then, that's when I came to know, the meconium was, he released it inside, and then we went to the hospital, and I had to then deliver.
Aspiration syndrome.
Yeah. All right. Very good. Very interesting. So these are what we can see in terms of the physical aspects of development of the child. And are there different types of Down syndrome, or is it just one type, or what is it?
When it comes to Down syndrome, we have no types of Down syndrome.
Okay.
It's all about your systems in your body which is going to get affected. So when you have Down syndrome, you have a lot of systems in your body. That is going to be multiple systems which is affected in Down syndrome. So you can't segregate it as types. Rather, one system will be affected and another system will be spared.
Okay.
So your central nervous system is obviously going to be affected. When you have a Down syndrome child, when you have a child with developmental delay, short stature, central hypotonia, the muscles of upper limb and the lower limb and the whole trunk of the body will be very floppy. That is central hypotonia. And when the baby has intellectual disability, you can suspect the baby to have Down syndrome. Ideally, central nervous system is affected. There are lots of other health concerns as well. We have completed central nervous system, and they also have high probability of getting Alzheimer's in the later part of the life.
So it means that not all children, you talked about intellectual development, it means that not all babies who have Down syndrome will have an intellectual disability. Some could be normal.
Yeah, and when we talk about intellectual disability, it doesn't have to be severely affected. It can be just mild to moderate, and that's why you can see a lot of Down syndrome patients, all the adults getting married, having a good life, even getting babies and getting a lot of employment opportunities and all that. They have a good role in community as well.
So if it is mild, that means it's not any amount of intellectual, if it's a very mild case of intellectual disability with a Down syndrome child, that child could be as normal as others, or there is still a slight,
there is going to be
some slight. Can this child go to a normal school?
They can not go to the normal school. Okay, you can enroll them in a normal school, but then we have a lot of teachers who are called as special need educators. Correct. You need the guidance of them, because when you talk about special need education, it's all about the educators being trained to train these child to lead a proper life. That is when it comes to educational settings and your domestic settings, that is your school and your home, you'll have to establish a regular routine. For example, if me being a teacher, say you'll have to go to bed at around 8 p.m. and if you're a parent on the other side, you tell that, okay, you can watch TV until 9 and you can go to bed at 9 p.m. That is going to be a discrepancy. So it's very important that there has to be some sort of like collaboration between the teachers and the parents, and there is a lot of need of repetition for these kids, because they are good in expressive language. I mean, they're good in receptive language than expressive language. They tend to understand what you say, but then they can't talk properly. They can't respond to your questions properly. There is going to be poor articulation of speeches and all that. Okay. So you can't expect them to do well in a normal school.
And they have the same kind of emotions like any other child, or they feel emotions to a higher level, they get upset more. They do realize at some point that they're not the same. So that emotional level of understanding they have, what is that, and how can parents, if they have parents have this children, how can they deal with this? How to...
Basically speaking, they have no problem with emotions, but then it's all about the stigma, it's all about the discrimination, it's all about what we perceive them as. And we as parents, we'll have to reduce our expectations. Instead of focusing on perfection, it is very important for us to realize that progression is very important than perfection. And it is very imperative for us to have realistic expectations. If at all, me being a parent, if I teach 1 to 10 today, I shouldn't expect the child to say 1 to 10 tomorrow.
Correct, right away, yeah.
If he or she says just around 1, 2, 3, I'll have to be happy with that. And I'll have to end up giving them positive reinforcement, reward, just ending up with small rewards, a chocolate or something like that. And that is going to enable them to enhance their creativity and to learn more and more. And that's how you can literally focus on positive reinforcement and the better well-being of the child.
So I believe that there are therapies and early intervention so that, we can have the best for these children also, because I do understand now, because of the cruel world that we're living in, they cannot go to normal schools. They will be stigmatized and they will be bullied upon. So there are special centers, I believe, where they can go, and there are special educators and special caregivers who can handle them. What kind of therapies, they can be given in terms of their learning, their teaching, their understanding of all kind of motor function, dexterity, finger dexterity, and all these things, like teaching them at an early age? What kind of therapies we can?
Early intervention is the best. It is a multidisciplinary approach. That is, it focuses on maximizing independence of the baby. They don't have to be dependent on someone for their survival. Second one is, it enhances the quality of the life, and it also reduces all the sort of discrimination and stigma. And the developmental outcomes is also going to be good if you put them in early intervention. And early intervention is all about your physical therapy, your occupational therapy, your speech therapy, and then you have your family support, emotional support, and all that. When it comes to your physical therapy, it's all about your physiotherapy. That is, we have already spoken about the gross motor milestones in our previous episodes, and it's all about standing, walking, running, and all that. And probably this is going to be impaired in these child. So you will have to provide them with all the sort of like maximum exercises, rehabilitation for them, for the muscles and everything. That is physiotherapy. When it comes to occupational therapy, it's all about sensory integration. You can teach them the colors, you can teach them the shapes, you can ask them to feel it. It's all about your sensory integration.
So basically you're trying to say that there are therapies to teach them and to get all their skills developed, but it will take time.
Yes.
And it takes probably much more patience for the caregiver who's dealing with the child to get them, but they will learn it at a more slow pace and much more delayed age.
Yes. Speech
what
therapy is very important, because the most common domain which is affected is going to be your speech and language. That is going to be poor articulation control here. The baby will be able to understand whatever you say, but then they won't be able to respond to your questions. That is, they have a good receptive language when compared to expression language. Then obviously when it comes to family, all that they need is your emotional support, your psychological support, positive reinforcement, collaboration, repetition, and a strict routine, and a common routine between the school as well as the home, that is your domestic settings and your educational settings.
Also cognitive development. Now we do understand that there will be mild to severe depending on child to child. So first of all, in terms of cognitive development, can you just highlight a few? What can we see in a child? If it's just mild, what can we see in terms of cognitive brain development? And if it's severe, what can we see with a child having Down syndrome?
Your learning is going to be impaired, it is going to be reduced. And your ability to learn faster is going to be reduced. And that time, it's the role of the special need educator to use a lot of pictures, charts, visual aids, visual cues, and some micro gestures for the baby to learn more and more. And when it comes to other skills, like maybe your social skills and everything, your social interaction may be impaired. And it is very important for us to remain patient throughout the journey, to literally encourage them to enhance the reciprocation and all that. So cognition is more about your intellectual disability. As I've already told, it is not going to be severely impaired. It is going to be just mild to moderate. And that's why, as I've already told, these people end up getting married, they are employed, and then we have no unemployment and all that. We have a lot of people, those who work as like office assistants, retails.
Yeah, there are, I do believe that there are certain jobs which are, specifically diverted for such individuals so that they can manage the task in a
office assistants, retails, arts, crafts, something like that.
I've seen them a lot at certain counters also, back in our country also. I've seen them
the ticket collectors.
At counters. Maybe it's a bookstore, if it's a small store or things like that.
But then you can't put them into any
stressful situations.
Stressful situations where there is going to be a need of more physical stress. Because when we talk about Down syndrome, there is going to be atlantoaxial subluxation. That is, the baby, the person, the adult with Down syndrome will be having some sort of like, they'll be highly vulnerable of this neck dislocation. Your C2 and C3 cervical spine will be affected.
Okay.
So if you put them into sports or something like that, that may lead to sudden immediate mortality, death.
Okay.
So that is going to be...
So basically, they're not able to hold up this part, the neck, the cervical area very well.
Yes.
So we cannot give them very strenuous,
Yes.
mild exercises, because I remember I used to go to a gym a couple of years ago, and there was a very little young girl, 13, maybe 14, very young child. She used to come very playful. She used to come especially for the Zumba classes. Okay. But that's light, I believe.
Maybe
that is
mild.
Okay. Yeah.
I'm talking about these
heavy
sports,
weights and things you cannot make them.
Sports.
Got it. You should not make them do it. Got it. Perfect. Okay. Brilliant. And now let's move on. So you said that they can have normal lives. They can even get married. But I don't believe that normally you would see maybe normal individuals will not be willing to...
I was not talking about the normal individuals.
No, yeah. It will be somebody, maybe somebody else who has Down syndrome.
Yes.
He will be willing to...
One more thing about the reproduction, the male will be infertile, whereas the female can reproduce. She'll be fertile. So we have a lot of other techniques, assisted reproductive techniques and all that, through which they can conceive and they can end up having a good life.
And then for such mothers who have Down syndrome, will they be able to take good care of their babies? And there are chances maybe their baby is normal, or it's not possible?
There are chances that they'll be normal, but then there is high probability that they'll be affected
They will
again.
be affected as well. It's maybe 50-50 or
something
like that. Yeah.
Yes.
And how can they care now if they have their babies, normal babies, suppose? Can these mothers be able to take that kind of care, or it's difficult for them?
It's all about the empathy you have for your baby. And one more thing, probably you will need a lot of guidance.
Right. And somebody to be there constantly.
Sure. Because...
Okay. And now, any other strengths that we see with such individuals? They have something unique. Are they gifted in a way? And besides the strength, and what are the challenges that we've obviously listed a few now? You've mentioned about the males not being fertile, and the mothers, maybe they may be able to or not be able to look after their babies. So let's take the strengths, if they have any strengths, and then we come to the challenges.
They have good visionary skills. They tend to learn by seeing rather than hearing. They have poor auditory system, but then because most of these kids, most of the Down syndrome patients, they have recurrent ear infections and hearing problems as well. Instead of auditory learning, they learn by seeing. So they have good visionary skills. And they tend to have good social understanding as well. Maybe they won't be able to reciprocate, they won't be able to speak, because most of the time the major domain which is affected is going to be a speech. But then they tend to have good social understanding. They know how to behave. So when it comes to social settings or something, they won't end up having an embarrassment situation, something like that. So these are the strength. When it comes to difficulties, you can enlist a lot of difficulties, be it whether abstract thinking, strategic decision making, problem solving techniques, or critical thinking, lots of things. They won't be able to decide. So they'll be able to propose a lot of theories, but then they won't be able to decide accordingly.
Okay. So for a child, now if the child is grown up, he's in that teenage year, normal daily routines in the house, doing some cooking or getting his clothes ready, ironed, wearing, those functions are easy for them to...
Yeah, we have been training for
They can do that.
Occupational therapy is all about like supervised feeding and toilet training, self-care, dressing and all that. We tend to indulge them into occupational therapy for these kind of things only. This is all about your fine motor skills.
Correct.
So they have no problem with that, because they are going to be ambulatory. They have no problem with that.
Okay. Now, parents' role. I believe the role of the parents is very important from the very childhood, young age. And what can parents do in such situations? Of course, there is the love, the nurturing, the emotion, the support, and then also there is some kind of whatever they can. There will be special educators also, but parents are the first educators, and mothers especially. So let's take the support from the time that they're born and in terms of when they start understanding a few things. How can parents come into the play, and what can they do firstly?
First of all, they'll have to understand that it is a genetic condition. It has nothing to do with the paternal fault or maternal fault for the baby to have this condition. It is all about genetics. And acceptance. Acceptance is very important. positive attitude is also very important. And when you accept and be open to this positive attitude, then only you'll be able to learn more about Down syndrome. And learning more about Down syndrome clinically is also very important for a parent to ensure the better quality and the better developmental outcome of the child. When we talk about that, regular screening is very important. As I've already told, hypothyroidism is more common in Down syndrome. Regular thyroid function test has to be taken by the parent. Yeah, obviously you will have to get the help of the doctor, but then you will have to
Monitor
all
as
that.
well regularly.
You should also know that the baby has hearing problems, vision problems and all that. And it is very important for you to take the baby to the ophthalmologist, ENT specialist regularly. And one more thing, when it comes to blood, when it comes to hematological conditions, these people are more prone to develop a cancer, which is called as leukemia, acute myeloid leukemia. So they can expect all this also. They'll have to take the help of a hematologist and the oncologist as well. And when it comes to GIT, the gastrointestinal system, they tend to have duodenal atresia. That is, your first part of the duodenum will be affected. It doesn't grow well and all that. There are a lot of spectrum we don't have to talk about it, but then these people will also have respiratory problems. So they are more prone to develop a lot of health concerns that the parent has to be aware of. So all of a sudden, if the baby has any sort of like symptoms and clinical manifestations, they will have to rush off to the doctor. And moreover, your empathy, your love, and having realistic expectations, as I've already told you before. You can't compare this child to a normal child. All you should have is a lot of patience. And yes, enrolling the baby into a special need educator is very important. And periodical physical therapy, speech therapy, occupational therapy, and family support is imperative.
Correct. Yeah, well said, Dr. Priyanka. I believe that giving them the love, the attention, the care is so important, because in today's world, even normal children, they face so much in schools. There is bullyism, and there is, teachers saying things, and there are a lot of times your peers, they feel sort of low self-esteem and all that. And then for a child who is special, it's so important that parents give them that support and nurture the love and the emotional support, so that the child can kind of blossom and grow up. And in terms of their age, are they able to lead long lives, or is it something that normally we see they're not able to?
When it comes to Down syndrome, people now, they live until 60 years of age. Some people actually live up to 70 years of age also. Before, around 1960s and 1970s, they had short lifespan, that is around just 20 to 30. But then within the past few decades, 20 to 30 years, because of increased awareness, because March 21st is World Down Syndrome Day, we tend to have a lot of rallies, we tend to have a lot of federations, fundraising, and then we have lots of stocks campaign and all that. Because of increased awareness, because of increased probabilities of having these prenatal techniques leading to genetical counseling and everything, the life expectancy and the periodical checkups as well, the life expectancy of the Down syndrome child has increased up to 60s to 70s.
They can go into old age, because I do see a lot of young, I've seen young children, teenage, I've seen tiny toddlers, teenagers, and maximum maybe youth, but I've never seen anybody who is maybe 50 plus or 45 plus. I've just seen that age. Maybe they are, as you said, and because
now it's gradually because of increased awareness.
Medical intervention, now they're able to prolong their lives as well. Okay, very interesting. And now, besides the fact that parents have a role to play, educators have a role to play, also society, society, if you are peers or friends and you come across such children or such adults also, then what is it that we can give a message to society, so that, first of all, that they be kind to them and they're able to not make them feel that they are humans who are different and they are humans who lack something. What can we?
When it comes to community, it is all about basic education. That's why we have World's Down Syndrome Day.
Correct.
Because we'll have to educate the community about the fact that this is not something leading to mental retardation. It's not something, they are not different. We'll have to make them accept that they are one among us.
Correct.
And regular religious participation or regular group gatherings and everything, social gatherings and everything, we'll have to invite them also. It's nothing like we have to isolate them.
Right.
Because
Well
they are
said.
just one among us.
Yeah.
They are employed, they do pretty well jobs, they are literate, and they can do everything. So it's all about our perception about something, right?
Right.
Yes.
And I think you've already busted a lot of myth, because I think a lot of people think that maybe the parent did something and that's how they are. But as you said, it's just something genetic. It's something to do with the cells, with your chromosomes when they're formed. And nobody has control over that.
Yes.
Of course, the age factor that you mentioned, yeah. But besides this, the causes, anything else so that we rule out completely?
Just two causes. That is going to be your error in cell division. The second one is going to be advanced maternal age.
That's it. There isn't any other major cause.
People say if you have folic acid, is actually conventionally we used to give folic acid preconceptionally for the mother to prevent the baby from having neural tube defects, but then it doesn't have any role in prevention of Down syndrome.
All right. So now in terms of the health concerns, we've seen a few already, but are there any additional health concerns internally, say some organs that will be different for these children who have Down syndrome?
I've already mentioned before, when it comes to central nervous system, you can have the developmental delay, you can have intellectual disability, short stature, and then central hypotonia, the floppiness of your muscles. Then comes your heart, that is cardiovascular system. And periodical echo screening is very important annually for Down syndrome babies, because they tend to have a lot of congenital heart defects, the most common being atrioventricular septal defect. We say it like that. Then we have a lot of spectrum of congenital heart conditions as well. That is atrial septal defect, PDA, VSD. We have a lot of entities.
So can you name these for a layman? What are these exactly happening? What happens to the heart? I think these are conditions where maybe they have a hole in the heart or their hearts are smaller, things like that. Am I right?
When it comes to heart, yes, true. When it comes to the embryology of the heart, you have 4 chambers, you have ventricles, you have arterioles. And then when it comes to PDA, that is patent ductus arteriosus, that is going to be a lot of mechanical hydraulics which is happening inside. All this is going to be impaired, leading to compromise in the circulation of the body.
So you mean to say that the heart will not be pumping like any other regular heart?
There is going to be a lot of strain. There is going to be an impaired cardiac cycle. There is going to be an impaired cardiac output, leading to heart failure ultimately. And we have a spectrum of clinical manifestations both in the newborn period as well as pediatric age group, different.
So basically parents have to be so very careful with such babies.
Yes, periodically annual echo screening that's why considered to be very important.
The echo screening.
Echo screening.
Okay, that's one of the most important things.
Yes.
Okay.
When it comes to gastrointestinal system, they tend to have something which is called as duodenal atresia, as I've already said. The first part of the small intestine will be affected. There is going to be a problem in passage of stools and all that. Then there is going to be something which is called as annular pancreas. There is going to be ring-like constrictions around the pancreas. And these are some of the GIT conditions.
So they will have maybe swollen pancreas or pancreatitis.
Constrictions
highly
and all that.
Likely with them? Okay.
Yes.
Okay.
When you talk about respiratory system, there is going to be obstructive sleep apnea. There is going to be increased amount of tissue in the neck, as I've already told. So while sleeping, there are high probabilities that they'll end up having obstruction, a lot of snoring and all that. When you talk about endocrine, they are highly vulnerable to develop increased risk of obesity and hypothyroidism.
Okay.
And when it comes to blood and cancers, acute myeloid leukemia,
they're more highly likely to have blood cancer, leukemia.
Yeah, immune system, your infections and everything will be there. Your immune system will be compromised.
This is certainly an eye-opener, and all this, not their fault and not even the fault of the parents. It's just something given genetically.
True.
And there is nothing that they can do to prevent. The parents cannot do. There is nothing, basically, right?
We can do with this.
It's, as you mentioned, it's just the genetics. It's just that the build is like that. It's all the chromosomes, the way they...
It's all about the error in cell division.
In the cell division error, as you said. Wow. That's such an eye-opener. And now that you've mentioned all this, we should be, I think, much more careful towards such individuals, because they're so unique. They've been born into this world with such a lot of different conditions, and I think human beings should be, all of us, we should have much more empathy towards such individuals.
True.
Yeah, okay.
Exactly.
So as we've seen now that there is nothing that we can do in terms of this, but in the second and third trimester, I believe not in this part of the world, but in other parts of the world, there are some kind of counseling done where parents have the right, whether they want to continue the pregnancy after the second. Third is, of course, not possible, but between the first to second, right? But not in this part of the world. They don't do that here. That is possible, right?
Yeah, true. We have undergone prenatal screening, and suppose after getting the prenatal screening done, and if you come to know that the baby is likely to have Down syndrome through karyotyping, then
There are
it's-
parents who have
yeah, you
decided
have
not to maybe
Yes.
continue with this.
You have to undergo genetic counseling. You'll have to explain the pros and cons of having a baby with Down syndrome. If they wanted to continue the pregnancy, maybe they can proceed. Or else some of the parents, if they don't want to continue, maybe they will opt for medical termination of pregnancy. As you told, not in this part of the world, but
Yeah.
maybe the other part of the world.
Yeah.
So informed decision making is very important, very critical at this second trimester, within about second trimester.
Earlier, I think between the first week or first month or so in the second.
Maybe around 15 to 16 weeks would be fine. Ideally, before 20 weeks. Before 20 weeks.
Okay. And we've also seen now in terms of their deliveries and everything, that stage is normal. There isn't anything when the child is to be delivered. There isn't anything different that the mother goes through at that stage. That's normal.
That's perfectly normal, because
Okay.
most of the time as a pediatrician we come to know only when we observe them in an NICU.
When you see the
Okay,
child. Yeah.
Because maybe most of the babies come back to NICU from the regular ward with the complaints of not passing meconium and all that, and then we tend to investigate and evaluate, and then we come to know, okay, we then check about the flat facial profile, we tend to check all the head to toe
Right,
examination.
that you've already mentioned.
Yes.
So now the parents have decided at stage 2, at second trimester, that they will go ahead with it, with the pregnancy. In those years, in those months, the following pregnancy till the end, and in the early years that a child is born, is there anything that the parents should start preparing themselves for?
All they'll have to prepare is they'll have to gather how much of a courage they can, how much of a patience they can, because
Patience is very important. Yeah.
having a normal newborn is very
course,
difficult. Then think about the newborn with Down syndrome. You have a lot of spectrum of difficulties with the newborn, feeding difficulties and all that. And it is very important for the parents to get educated about the pros and cons of Down syndrome. It's not like you just continue with the pregnancy and then abandon it or get irritated with all that you are going through.
Right. We now jump into some myths and misconception, and there are lots, around this. Like a little earlier, you mentioned that their cognitive development is not completely impaired. It's from mild to middle range,
Yes.
And I always thought that, there is severe cognitive impediment or something. So what else are the other myths and misconceptions that people have? Maybe in terms of longevity. What is the myth around that, and how true is it?
When it comes to longevity, most of the people think that, okay, they won't be living for long years. But then people, as I've already told, in
Medical
1960s,
intervention now.
Yeah, because of the good multidisciplinary approach, medical care and everything, we have increased the longevity of the patients up to at least 50 to 60 years. Some people, if at all, if they receive good care and if they have willpower, they extend up to 70 years.
Wow, interesting. And also marriage, I believe. I think that a lot of times we think that they will not be able to marry. And as you mentioned before, yes, they will marry, but the males may not be able to develop their sperm count.
If we end up having 2 Down syndrome patients married, they can understand each other, they have a lot of empathy towards each other, they have a lot of mutual respect towards each other, out of which they might also go for assisted reproductive techniques, IVF and all that, with which the girl will be able to conceive. She's still fertile.
Correct.
She's not sterile, so she'll be able to conceive, she'll be able to deliver a baby.
Right.
So they can also lead a meaningful life in terms of
Right.
marriage, in terms of education, in terms of occupation and employment.
Okay.
Most of the people think that they don't have a meaningful life, but that's completely a
It's
myth.
a myth, yeah. They can have regular, meaningful lives. And as you also mentioned, that we should incorporate them more into our society, into our regular gatherings and such. And now that we know that, of course, it's not a fault of anything that they have done. It's just that they were born like this. It's so important that we should be more inclusive towards them.
True.
And besides this, in terms of their own babies, right, there could be a chance that their baby could be normal as well, right? It's not
Yes,
necessary.
It's not mandatory that they'll have to have a baby with Down syndrome. They can have a normal baby as well. So most of the time we tend to think that, okay, a baby who's born to a Down syndrome parent will also end up having Down syndrome. It's not
Like
mandatory.
that. It's not. Correct.
Most of the time, if you want me to talk about other myths, like most
Yeah,
of the
any other myths that you could share that are around the babies with Down syndrome or individuals with Down syndrome, and what is the truth about them? Please shed some light.
Most of us think that, okay, Down syndrome children, like all the Down syndrome patients, look alike, since we have that Mongolian slant and all that.
Right.
But then it's completely a myth. We have a different phenotype, a different facial feature, a different physical feature. All the patients are different. It's just that the Mongolian slant, that upslanting palpable fissures, which is common for most of the Down's kids, we end up saying like that. But it's not like that. Each of us are different. They have a different phenotype. Then coming to a next myth, most of us think that they can't attend schools and all that. No, we have special need education, we have inclusive schools, out of which we can enable the educational rights of the baby. Then coming to another myth, most of the time I have heard people saying that most of the Down syndrome children look sick and ill. It's not like that. Most of the children, maybe they have a lot of fatigability, because of which we tend to have that thought in our mind that they tend to appear ill and sick, but they're not sick. They're good.
So in terms of the community, of course, we have to be more inclusive and let these individuals be a part of our society as well. What else can we do as a community? Raise awareness, of course. More awareness will cause people to be kinder and more compassionate towards such individuals. What else can we do as a community towards such children and adults having Down syndrome?
We tend to have a lot of resources which is available online. We can educate the community about Down syndrome. It is not like some rare condition or genetic condition, something like that. We don't have to be so cautious about it. We have a lot of resources which is available online. For example, International Down Syndrome Federation we have, then we have National Down Syndrome Society. Lots of forums, lots of public events are being organized. We have walks, we have rallies, we have a lot of fundraisers, and we have something which is called as Lots of Stocks campaign. That is like you tend to wear colorful socks and mismatched socks. And that is to increase the awareness. Yes, you tend to encourage the Down syndrome patients. That's we are not different. You and I are same. It's all about showing your empathy, your compassion, your passion towards kindness.
Okay, now in terms of the rights of such individuals, what is it that they can, what kind of rights that we can give them, what kind of rights that they can fight for themselves, or maybe the parents at an early age? Of course, we know that they should be given a right to get these children educated, maybe in special schools or whatever. What else besides that? What are the rights that we can give such individuals?
It could be your health rights, it could be your employment rights, it could be your educational rights. When it comes to health rights, they have all the rights for accessible health care, be it whether medical care, multidisciplinary approach, regular periodic screenings, because of which we can reduce the mortality and the morbidity related to Down syndrome. So they have accessible health rights. When it comes to education, it's nothing like we can isolate them. We have inclusive schools, as we have discussed earlier. We have special need educators, out of which they can undergo a lot of sensory integration. They can learn all that so that they don't end up being an illiterate. Then we have employment rights as well. It is nothing like, okay, just because they have Down syndrome, they'll have to suffer the bitterness of unemployment. We have a spectrum of roles for them, employment opportunities, as we have told, like they can sit. Being a non-ambulatory patient, they can sit, they can work for a lot of
Organizations or a lot of places.
They have a
where-
good
Right.
organizational skill. Like literally,
Right.
they can be a ticket collector. They can work in
Right.
retails. They can do arts and crafts.
Answering phone calls and
They can do it.
giving some. Are they good at mathematics? Giving change at the counter and things like that, or
Just ticket collectors.
ticket collection? Okay, simple as that. Okay.
Yes.
All right. Thank you so much. Thank you so much, Dr. Priyanka, for coming on the show and busting such a lot of myth and giving us so much information about Down syndrome. It's an absolute pleasure to have you.
It's my pleasure to be on the show as well. Thank you so much, Shahnaz Mirza. Thank you so much for the opportunity.
So this was the end of the episode. If you liked it, do like, subscribe, and share the episode. And do let us know what else would you like to hear from us. We are here to produce more episodes for you. And also put your comments below at the end of this YouTube video so that we can improve our videos. Till we meet next time, do take care of yourselves. This is Shahnaz Mirza signing off from Unfiltered Talks with Shahnaz Mirza.